Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, we couldn't have a bigger debate over Medicare and the various plans that are put forward by the presidential candidates, plus the implementation of the Affordable Care Act in Pennsylvania. We'll have that, plus an important energy update. All of that follows these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. We're going to start with a healthcare update with Mike Strazzella. He's the Senior VP of Federal Relations for the Hospital and Healthsystem Association of Pennsylvania. Mike, welcome.
Thanks for having me.
Look, first, let's talk about the implementation of the Affordable Care Act. I used to say the critics call it Obamacare. Now the Democrats call it Obamacare, right?
One's taking ownership and one critiques.
Yeah, that's exactly right. So how does that stand in Pennsylvania? Give us an update on the big features of the Affordable Care Act and how it will play out in our state.
Sure. As most of your viewers probably know, the U.S. Supreme Court handed down its decision, and two big pieces came out of that. One was that the individual mandate could move forward. It was ruled constitutional through a tax provision.
Right.
And the second piece of this is that it put back the onus on the states to allow them to opt in to a Medicaid expansion, to pull the 1.6 million people, 1.4 million people in Pennsylvania that are currently uninsured and allow them to move into the Medicaid expansion.
If they qualify for Medicaid.
If they qualify. And that number actually shrinks once that happens, from 1.4 to somewhere between 600 to 700,000 Pennsylvanians would be able to qualify.
So just so we understand it, under the Medicaid expansion, as part of the Affordable Care Act, 600,000 to 700,000 Pennsylvanians, you estimate, could qualify for Medicaid.
Correct.
Now, what's the there's still a big looming question out there. What is it?
Well, the big question is, one, how many of them will? How many of them actually overlap with still the ability to move into the exchanges? It's not just a clear line between Medicaid expansion and this exchange under the Obamacare.
And I want to talk about that exchange.
There's a gray area. There's a gray area where people may qualify for both.
But even before that, there's a big decision that Governor Corbett has to make. What's that decision?
Very large decision, whether he's going to opt in Pennsylvania to decide to expand Medicaid and try and bring that 600,000 people in. I don't think he's going to make that decision anytime before the election. I think he will wait to see what happens with the federal elections. The U.S. Senate, who controls it, right now it's Democrat, will flip to Republican. Will the majority increase in the U.S. House of Representatives? I don't believe it'll switch to Democrat, but I do believe that their numbers may shrink on the Republican side. And the question will be the Romney-Obama matchup. Who's going to win the White House?
And there are about 8 or 9 states, the last count I saw, that have opted out so far. Texas being, I think, do I got that right, the largest of the states?
Texas is the largest, and they came out guns blazing in the way they do in Texas style.
Yeah, right.
So he was very adamant about not moving his state.
Governor Perry, we're talking about.
Yes,
go ahead.
Governor Perry moving into expanding the Medicaid program for their state.
Now, if Governor Corbett opts out under the Supreme Court ruling, Pennsylvania cannot be punished for its other Medicaid monies, correct?
Correct. And recent statements by the Secretary of Health and Human Services has also said, if you decide to opt in, you can opt out later on if you want. So they recognize there's going to need to be some give and take here and be flexible here and try and pull people in, and hopefully once they're there, they'll stay there.
You know, you represent, of course, the hospitals in this state. And how important is Medicaid payments to hospitals? Because after all, you have to take patients. I mean, if someone comes in to see, shows up in the emergency room, under law you have to treat them. You'd treat them anyway because that's humanity, right?
We treat them regardless of ability to pay.
I got it. How important is that to hospitals that you get paid for people who show up at your door?
Well, right now in fiscal year 2011, hospitals estimate about $1 billion worth of uncompensated care, meaning care that people would come in, wasn't paid for, uncompensated care, things that we reached out to the community to do. So it's $1 billion collectively among all the hospitals in the state. So when you start to cut down and we look at moving possibly 600,000
Right.
people into the Medicaid program. Although we're underfunded based on cost, we're still getting reimbursement to a degree, closer around 88 cents on the dollar. When you look at people moving from the uninsured column to a federal exchange and that reimbursement coming into hospitals, that's going to cut down that uncompensated care. And that's going to allow hospitals to use those monies to upgrade their information technology, to upgrade the services they provide, the facilities that they provide, try and attract different types of providers into their systems.
Yeah, we don't have time. Maybe we'll have you back. I want to talk about this shortage of physicians that we're likely to have, and if we get this tremendous expansion, what that means is the healthcare system, does it have capacity to deal with it if suddenly, you know, once you get insurance, people are going to use it. That's the one thing
right.
I think we know. All right, we're going to go to a break. When we come back, I want to ask Mike about the big Medicare debate going on, and talking about bills. We're going to take a minute or two and pay our bills, and we'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business. This broadcast of Pennsylvania Newsmakers is brought to you by BetterSaferRoads.com. To voice your support for safer highways and less traffic congestion, visit BetterSaferRoads.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back. We're talking about health care. We're getting a great update here. We looked at Medicaid. Now we're going to look at Medicare. I don't think there's a bigger debate. It has now become part of the presidential election, second probably only to the debate over the economy. Mike Strazzella is here. He's with the Hospital and Healthsystem Association. All right, let's look at the big picture here. There isn't any doubt that we have a long-term Medicare problem. 70 or 75 million people eligible for Medicare in the next 25, 30 years. We take out from the government $200,000 more on average than we put in. Is that unsustainable or what? The way it is now?
It would be in my household.
It would be in your household, right. So let's talk a little bit about, you know, we've got these different plans out there. Talk a little bit, explain a little bit about Medicare and how it's situated in Congress and politically with some. I know you only have about a couple minutes to do it, but let's try.
We'll see how well we can do this.
All right.
First off, hospitals, as part of the Affordable Care Act, we did support that. We recognize that that in order to fund that program, there were going to have to be some federal payment reductions.
Right.
And hospitals agreed to some of those, about $7 billion for Pennsylvania hospitals.
So you'll get less money.
We will get less money to make sure that more people get insured.
Get covered. I got it.
Now, on the other side of that, that's only legislatively. We still have constant bills to pay at the federal government. We recently saw that Congress wanted to extend the payroll reduction from 6.2% to 4.2%. People saw that in their paychecks. In order to do that, that costs real money. Hospitals have been brought into those debates to help fund the larger pieces of the pie. When we move forward and look at the end of this year, we have a huge fiscal cliff coming. We have Bush tax cuts that are going to expire, the payroll tax. We have a litany of different things. All sequester, which is a provision that automatic reduction, spending cuts starting in January. These are all going to total about $5.5 billion. So when we look at hospitals being brought into that debate, we could get cut once again. Now then there's the larger issue that we've started to see over the last several weeks with the vice presidential candidate pick of Paul Ryan from Wisconsin. In bringing him forth, he's somebody who had a very bold vision for the Republican Party. As chairman of the House Budget Committee, he brought forth a litany of changes, systematic changes to Medicare, not necessarily payment, but systematic, that would change how people buy and where they buy their health insurance when they're in the Medicare program.
Now, Romney's plan differs somewhat. I mean, there are basically two ideas. Tell me if I'm right. You got you could stay in under the Romney plan. That's probably what we really. You could stay in traditional Medicare, or you could opt out and buy coverage on the open market. Now, you would get a stipend from the federal government to do either. And so the real question is, down the line, would the stipend cover the actual cost of the coverage, and would seniors. No one now under 55, but does anybody, can you
well,
know
I think that's
now?
One of the big thing. That's one of the big pieces of this, is there's been a term that I've started to see play out in both campaigns, where they've started to talk about impact on current seniors.
Yeah.
And that's because these plans have really mainly been proposed to affect the 55 and under.
Right.
It's not necessarily the
Right.
changes where somebody who may be on Medicare currently is going to have to change.
That's a political calculus. Let's get that. Nobody wants to anger seniors.
No,
right?
you definitely don't. We remember those debates back in the 80s.
Yes,
and,
we do.
And we don't want to see those again. And so I think for people who are younger, they're not thinking that they're going to retire at 65, especially in light of today's economy.
Yeah.
They're thinking they're going to have to work till at least 70, 75, or as long as they can. So it's going to be harder for them to really imagine what the costs are going to be.
All right, but let me ask you the fundamental question here. In Medicare reform, something you've studied, is it possible to fix it without doing two things? One, somebody's going to have to pay more, and or benefits, services are going to have to be modified, and I'll use the word reduced maybe, a combination of those to pay for the $65 trillion estimated that it will cost in 30 years. Is that likely?
Well, we've started to see those payment reductions. I think the one thing that needs to be reviewed here, and as part of the Affordable Care Act, we're going to see this, is a change in the delivery system. How is the healthcare delivery system going to reform?
And can
How
that
is it going to be?
Can that save money?
Absolutely.
That can save money. Can that do it without?
It can't do it alone.
Can it? Do we?
We need to see several other issues.
How about
at play
cuts
here.
to
We need to see medical
beneficiaries?
liability reform.
Yeah,
that's going to
true.
cut down dollars.
Right.
We need to see maybe an age, a qualifying eligibility age into Medicare, maybe
Right.
pushed back 2 years, such as we've seen in
we're
Social
living
Security.
longer. We're living longer.
Those are the reasons why
Right.
65 were picked originally, because
Right.
of life expectancy. We're living longer, so we need to be able to have
Okay.
a real conversation.
Well, you'll
with
come back.
seniors.
We're gonna move on, but you'll come back when we start to implement this and help understand this, particularly your role, the federal government. You're paying close attention. This was I think, a very clear update for the folks. Short answer is something has to give with Medicare. We can't go on the way it is, even with the changes that are proposed. Something bigger is going to have to happen, in my humble judgment.
And this will be a very public debate.
Yep, good. All right, when we come back, energy, can we talk about another subject that's in the news? We'll do that after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education, 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. We have a couple of very important topics to discuss in the energy-related field. As you know, it's emerged in the presidential election. We're not going to go there, but we're a big energy-producing state in Pennsylvania. Energy is always in the news. We couldn't have someone better to talk about it than Terry Fitzpatrick. He's the president and CEO of the Energy Association of Pennsylvania, former member of the Public Utilities Commission, who is, after all, regulating the parts of the energy. Is that fair to say? Parts of the energy business in our state. All right, two sort of controversial aspects of this in the news. One is newspaper reports, and I guess Fox Television in Philadelphia, on these electrical fires in some places in the Southeast, may be related to smart meters in the homes. First of all, what's a smart meter?
A smart meter is a new technology of meter which is capable of two-way communications between the utility and the customer, also capable of measuring not just the total amount of electricity you use, but when during the day you use it. So it enables some new types of pricing plans where you can pay different prices, time of use pricing, which is something that I think we need more of in the electric
And they're installed in the home?
Yes, correct.
And the problem that we now see is there's been some electrical fires which could be related to these smart meters.
Correct.
Explain that.
Yes, well, some of the fire officials that have gone in after these fires have taken place have thought that that this advanced meter, which is the term we like to use, is the cause of that. Now, Pico Energy, the utility in the Southeast, has taken a look at that and is really taking it seriously, is investigating it. Temporarily, it has stopped putting these advanced meters in. It's in the process of switching over to this new technology. But they're doing an analysis of what happened there, also working with one of the 3 vendors they have putting these meters in. They can make some software changes where remotely they could get an advance warning if the meter would happen to be overheating, or they can also shut it down. So, you know, Pico's taken this seriously.
Yeah. Oh, no, sure. Potentially, is this an overheating problem? I mean, just potentially. Is that what they think could be at the cause of this?
They're studying it now.
Okay.
They don't know whether it's related to that or to other electrical issues that there might be in the house. But I think the important thing from an industry-wide and a public policy standpoint is this. There are some questions being raised about these meters because they've been controversial in some respects.
Yeah.
I mean, there are some people who are saying that they don't like the fact that with the capabilities that these meters have that go along with them, where they can measure how much you're using, when you're using it. Some people have raised Big Brother type concerns about it. But on the other hand, it is the newest state-of-the-art technology. It has the advantages of making possible these new pricing plans. It also has a very important benefit when it comes to outages, because one of the things the utilities can do with these advanced meters is we call it pinging. They can send out a signal. They can see whether your electric service is on or not. That is very important when you have widespread outages. It allows the utility to quickly determine where service is on and where it isn't on, to get it on for everybody more quickly.
Maybe you don't have an answer to this. Are there parts of the state that have implemented the use of smart advanced meters more than others? Is it more down in the Southeast as compared to rural, or is it? If you don't know, that's fine. Just curious about the geographical distribution.
Yes, well, a law was actually passed in 2008, we call Act 129, that required that all utilities move towards these advanced meters. Okay. So that's important. That's public policy. We have to move towards it. Different areas are ahead of others because I think it's easier to do this in areas where you have a greater concentration. But all the utilities are moving toward it pursuant to this law, so that's the public policy of the state.
All right, let's after we take a break, let's talk a little bit about the other controversial, which is part of the Marcellus Shale law that was passed that deals with local zoning and who should have control of that. We'll talk with Terry Fitzpatrick about that after the break.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Hi, well, we're chatting with Terry Fitzpatrick, who's President and CEO of the Energy Association of Pennsylvania, about a couple of controversies that have erupted in the state, one more recent than another. We just talked about the smart meters and the potential of whether electrical fires at the cause of that. And one of the other big issues has to do with who should control local zoning during the Marcellus Shale production phase. There's lots of complexities to it, but Terry, let's talk about, first of all, what's the current Marcellus law say about local zoning versus state control, and then we can talk about the court case.
Well, one of the things the recent Marcellus Shale law did was it preempted local zoning ordinances and put in place a state requirements in state law for how the local governments could regulate that. And the goal was to have a uniform state policy to make sure it allowed the drilling to go forward on a reasonable basis. At least that was the intent. Maybe reasonable is in the eyes of the beholder sometimes, but there were restrictions put on the zoning capabilities of local governments to make sure that in the eyes of the draftsman at least, that zoning wasn't used to actually preclude drilling for natural gas.
And that's at the heart of the controversy, because local Pennsylvania being Pennsylvania,
Right.
every community sets its own, zoning regulations, and the fear and the loss of local control is at the heart of the opposition, the objection. Is that correct?
I think that's correct, and I think we have more local governments maybe than any other state.
By one count, about 25 or 2,600.
Correct.
All right, so they took it to court, and we had a court decision, the Commonwealth Court, which is the lowest appeals court level. Ultimately, this will go somewhere else. We'll talk about that. Pick
Correct.
that narrative up.
Yes,
Commonwealth Court ruled.
A number of the municipalities and some of their groups brought a suit in Commonwealth Court saying that the Marcellus law was unconstitutional because of the impact it had on local zoning laws and the expectations maybe that some property owners had under those laws. And they found it was a divided court. I think it was closely divided. There were maybe 4-3 decision held it unconstitutional. That's not the end of the story, of course. The Corbett administration, as well as some others, are appealing that to the Pennsylvania Supreme Court, which will rule on it, and who knows what that decision is going to be.
Yeah, the court's divided 3-3, 3 Republicans, 3 Democrats. The 7th jurist is on administrative lead facing prosecution. But typically, these kinds of issues don't break down along party lines. I've followed the court a little bit. I mean, there are other things like redistricting and maybe the hotly contested ID law, ID law for voting, Mike. But certainly, your sense is that it won't be a political decision.
It's hard to speculate in things like this. I
Sure.
think my observation of the Supreme Court is that they call it straight down the middle, and it's really a legal interpretation. It's hard to predict on political lines how they're going to rule on this, and I think, frankly, that's a good thing, because I think it helps develop public support for the courts.
I noticed when they were doing this so-called cracker plant, which would take natural gas, ethane to ethylene, and what we ended up there was labor and business on the same platform with Governor Corbett urging that, and there's some environmental concerns, obviously, so you have, but it didn't break down, and that's what you're suggesting, is that this is not the kind of issue that break down along party lines.
I believe that, Terry, yes.
All right, well, thanks, great update. You'll keep us posted on this smart meter thing. You can come back and give us a hint about what will happen. All right, thanks for watching this edition of Pennsylvania Newsmakers, and as always, we will see you next week.